It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following. Why should you be worried about your dog's arthritis? Arthritis, also called osteoarthritis or degenerative joint disease, occurs when the cartilage in the joints breaks down over time, causing pain and limiting joint movement. Because arthritis is very common in older dogs, it is important to be able to recognize the signs and care for your pet appropriately. 1. Why should I worry about my dog's arthritis? This process is degenerative, progressive, and irreversible. Fluid builds up inside the joint, cartilage may thin, and small bone growths, osteophytes, may develop around the joint. All of these processes cause chronic pain and inflammation. Approximately 25% of dogs are diagnosed with arthritis, although an additional 35% may not be diagnosed until it is accidentally detected on X-rays. Osteoarthritis can affect dogs of any age, sex, and breed. Certain conditions that can cause arthritis, such as hip dysplasia, are more common in certain breeds. 2. Causes of arthritis in dogs. Primary arthritis usually affects several joints. This is considered a cartilage disease associated with aging. Secondary arthritis usually affects only one joint. The causes of secondary arthritis are as follows. Trauma, bacterial or fungal infection, joint fluid, cartilage or bone, immune-mediated diseases, developmental malformations, hip or elbow dysplasia, abnormal cartilage congruity, joint capsule anatomy, joint incongruity, joint malalignment. 3. Clinical signs of osteoarthritis in dogs. Lameness, periodic, progressive or persistent. Stiffness is common after periods of rest, but may improve with activity. Lameness may worsen with excessive exertion. Joint inflammation. Pain. Decreased range of motion. Muscle loss/atrophy due to disuse of limbs. Thickening and scarring of the joint membrane, pericapsular fibrosis. Squeaky sound during movement. 4. Diagnosis of arthritis in dogs. If you suspect your dog has arthritis, make an appointment to have him examined by a veterinarian. Your veterinarian may perform an orthopedic physical examination to check for joint subluxation and dislocation, displacement, out of the joint cavity. Sometimes this type of exam requires light sedation to ensure your dog is comfortable. X-rays may show increased joint fluid, swelling of the soft tissues around the joint, osteophytes, hardening and thickening of the bone, and/or narrow joint spaces. X-rays can also help your veterinarian identify underlying disorders such as hip dysplasia, torn ligaments, etc. An arthrocentesis, aspiration of joint fluid with a needle, may be recommended to culture for bacterial or fungal growth. Examine the joint fluid under a microscope. Large numbers of synovial cells are a common finding in arthritis, and evaluate the types of cells. A CT scan is useful for visualizing joint abnormalities, especially before surgery. Treatment options for arthritis in dogs. There is no cure for arthritis, only therapies that help control it. Treatment is medical or surgical, or both. The goals are to decrease pain, improve joint range of motion, and minimize joint degeneration. Medical management of arthritis. Weight loss, exercise on soft surfaces, avoid slippery surfaces. Warm compress on affected joints. Non-steroidal or steroidal anti-inflammatory analgesics, neuromuscular analgesics, opioids. Glucosamine/chondroitin supplements, omega-3 fatty acids, vitamin E, green-lipped mussel. Acupuncture. Hot or cold laser therapy. Intra-articular stem cell therapy. Rehabilitation, hydrotherapy, passive range of motion and stretching exercises. Surgical management of arthritis. Depending on the affected joint, the age and weight of the dog, the state of health of the dog. Carpal/tarsal, wrist/ankle, arthrodesis, joint fusion, total hip replacement, femoral head and neck osteotomy, amputation and more. The response to surgery may vary depending on the joint affected and the procedure performed. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.